let's focus on what should be the path forward, because this is something I've been really thinking about. And because what I see happening right now is, as I put it, the policy, the view, the way of dealing with a dangerous or deadly virus, the method is basically to stop everyone from living. That is the current method. I think that's very just immoral, and I think that cannot be the right solution. So I've been thinking a lot about what is a path forward that allows us to live, but also allows us to effectively fight this virus and save as many people as possible. And so I want to share with you that this is my current thinking on what the platform should be. And I'm particularly interested in ideas or additions that people in the audience have. And in particular, if you study this issue professionally, definitely that. But even if you've been studying it in depth and you think there are a lot of good examples, or you think there are counterpoints that I'm wrong about, I definitely share those to alex@alexepstein.com, because I want to write something about this. But it's the kind of thing it needs to be. I'm thinking of it as a skunk works. I'm putting together certain people to do this, because I think I can help a lot with the framing of it, with the thinking of it, with the explanation of it. But I need to work with people who have expertise on a lot of the details of it to make sure that I'm getting, at least have the best possible chance of getting those things right. So here's I'll take a drink of water in a second and then give it to you, and try to give it to you in 15 minutes. But my overall title is Don't Stop Living, Live Smarter. And it's an American path forward on COVID-19. So I want to talk about, what does an American path forward on COVID-19 look like? So I'm going to summarize this. It's going to be 6 steps. I may change the number of steps, and then I will elaborate a little bit on each step. And then if we have time, hopefully you guys can chime in. But here are the 6 steps. So 1 is acknowledge the difficult reality we are in. 2 is recognize that an indefinite universal lockdown is both impractical and immoral. 3, massively increase testing and transparency. 4, liberate American ingenuity to massively increase treatment ability. 5, help the vulnerable minority protect themselves. And 6, go back to work with distancing best practices. So 1 is acknowledge the difficult reality we're in. 2 is recognize that an indefinite universal lockdown is both impractical and immoral. 3 is massively increase testing and transparency. And that's the one I'm going to focus on, actually, along with 4, liberate American ingenuity to massively increase treatment ability. And then 5 is help the vulnerable minority protect themselves. And then 6 is go back to work, and for that matter, go back to school with distancing best practices. So I think that this is essentially the right policy in a wide range of scenarios about the specifics of the virus. So try to go through this quickly to just give you an overview, and then very eager for any feedback or ideas you have about any of these points. So you can send those to alex@alexepstein.com. So the first 2 I'll try to go through really quickly, because I've dealt with some of them already. But number 1 is acknowledge the difficult reality we're in. So I do think that the growing spread of COVID-19 in the US and around the world is quite possibly the most dangerous infectious disease challenge we've faced since the Spanish flu over 100 years ago. So I'm not certain of that. And there are reasons why it could turn out. There are reasons why I don't think we should be nearly as catastrophist as some of these models are saying, but there are a lot of reasons to be seriously concerned. And I'm certainly not going to act like I'm certain that we shouldn't be concerned. So I'm inclined to be quite concerned. And so there's strong reason to think that the worst case scenarios are highly exaggerated. It may be inevitable that there's tragedy. I think we certainly have to accept, unless you are an expert with a really strong different view, I think you have to accept that as a possibility. And we can talk about what could have happened differently in the past, but we're at a situation where we have the spread of this virus, and we're really not we really have not been prepared for it in terms of a testing level and a treatment level. And those are facts. And then this brings us to step 2, which is recognize that an indefinite universal lockdown is both impractical and immoral. So anyone who thinks that, oh, well, here's an easy solution, let's just have an indefinite universal lockdown and then we'll just kill the disease and everything will be good. Like, that is no solution at all, even though it's been the solution, the attempted solution in effect, which we're seeing just completely fail in terms of human life overall. And so one thing in terms of the practicality is in the United States, an indefinite universal lockdown is not going to work. And I'm glad it's not going to work unless you totally change the character of the country, impose martial law. I don't know where you're going to get those resources from when everyone is poor and not able to produce. But the idea that, oh, we can just lock everyone down indefinitely, like that'll work for 2 weeks, maybe 3 weeks, not going to work for 3 months. It's definitely not going to work for 18 months. And many people say 18 months is the period that we need to be really in action. So even if you could supposedly do this in China, and that's a good idea, like you can't do it in the US. And more to the point, you should not do it in the US for the reasons that I've mentioned. To stop people from interacting, that's a fundamental violation of their freedom. To just do that in a universal way that prevents them from pursuing their livelihood, that is so destructive. And it's destructive in every aspect of life, including survival itself. I mean, you'll see suicides go up, you'll see poverty go up, you'll see shortages of all sorts of things. And anyone who has good data on this, by the way, I'm interested in that. There's a lot more to say about this, but I've already talked about it. So I want to focus on the more proactive parts of the plan. So once we recognize, okay, we're in a very difficult a very difficult reality, even if we wish we weren't or we shouldn't have been. We got to recognize that an indefinite universal lockdown is both impractical and immoral. And step 3 is then massively increase testing and transparency. So this is really the key, and it's been talked about, but it hasn't been talked about nearly enough and not in quite the right way. I'm going to run a quick test with you guys. Can you still hear me? Can you guys still hear me?
Yeah.
Okay, perfect. That my AirPod is having some sort of static, and it was just like, it acted like it was about to electrocute me. So I wanted to avoid electrocution while talking about living and avoiding death for that matter. So if we think about what's wrong with the case for universal lockdowns, part of it is it's based on the premise that Americans, if left free, will be mindless and inconsiderate. And as I've said before, this is really untrue. It's been demonstrated to be untrue. A lot of us, including I'm sure all of us on this call, have engaged in a lot of voluntary behavior to protect ourselves, but also to protect others and to try to limit the spread of the virus as long as we could do it in a kind of cost-effective way. But what's also true is that we could exercise incomparably better judgment if we had more information. And so the foundation of a free people's response to this virus has to be information. How deadly the virus is, how prevalent it is, what available, and also, this is a really important one, what are the available treatment capabilities in my area? Because if you knew that, if you could just really have a hot map of who has it, where it is, and what the treatment capabilities are, then you would be in, like, you could act so rationally. And so that's what we should be aspiring to. And I think if we look at the government's failures, I don't want to talk about all the specific things involved, but I think there's been a combination of restrictiveness with regard to testing in terms of preventing private actors from testing. And there's definitely been a lot of opaqueness. Like, we really don't know what the state of testing is. There hasn't been the transparency. And so I think that government's number one priority should be systematic testing and sharing of precise information with all Americans. And it needs to do certain things in terms of its own practices, but one thing it definitely needs to do is it must liberate American ingenuity to work on both developing new types of tests and also the mass production of tests. So that's been happening a little bit, but I've still been seeing there's a lot of restriction going on with the development of tests. And I think it has to be, no, our number one goal is to give all kinds of information. And I'm interested in what people think about are the most important kinds of tests. I think it's really important to do tests so that we know the actual rate of infection in randomly sampled populations. It will be really valuable if we can understand not just who has it now, but who has had it in the past. That'll what these kind of these different kinds of tests, including monitoring your antibodies or testing for antibodies in ways. So this is really the systematic and transparent testing. This is the key. So for example, in terms of the government, if there are situations where the government needs to make targeted responses, and I think if it's using coercion, it needs to be very careful and very clear about the duration. But if it wants to do some kind of tracing, like seemed to work well in South Korea, needs information, needs systematic testing, and definitely needs transparency. But then if you think about what this will do for us as individuals and organizations, it'll allow us to make very intelligent distancing decisions based on, based on where we are and based on how at risk we are in particular. So far we have that if we have systematic and transparent testing, it'll enable governments to make targeted responses, and then it'll enable individuals and organizations to make very intelligent distancing decisions. If we really know the specifics of, okay, where is the virus? How dangerous is it? How dangerous is it for our specific population? The more precise it is, and that's part of being systematic, just the more intelligent decisions we can make, as well as knowing these things about hospital capacity. And then in terms of if you have systematic and transparent testing, imagine what it does for medical professionals making intelligent treatment decisions. It's just, if you think about things like allocating resources, where people are most needed, where masks need to go, like the more details we have about things, the more intelligence people can exercise. A truly American response is free people exercising their ingenuity to just figure out all kinds of ways to stop this, to avoid this, that some centralized authority is never going to be able to figure out. But we need information. Right now, we're totally handicapped, and that's something the government can and must take a leadership role in. And part of that is being very, very transparent. So that's step 3. So that is massively increase testing and transparency. And then step 4 is liberate American ingenuity to massively increase treatment ability. So the greatest asset we have in the fight against COVID-19 is not our ability to enslave people. It's human ingenuity, whether in diagnosing, treating, developing drugs to mitigate COVID-19, developing vaccines, shifting resources around, repurposing factories, speedily scaling production. All of these things require human ingenuity. And what that requires above all is freedom. And so the main role government has to play here is to lift the dozens of irrational controls that are inhibiting the medical industry from scaling treatment. And so we don't have that much time, but Don, I know you've been sharing with me a couple of examples. What are things that strike you about what government is doing to control production in this realm that it needs to stop doing so that we can liberate human ingenuity?
Yeah, I mean, one thing I'll say first of all is that things are changing so fast that some things might not be enforced. And in fact, I've been impressed with a number of the regulations that have been rolled back and changed. I've not been impressed by the fact that they were in place. But for example, with testing, initially the government very tightly controlled who could do testing, and that was led to these long delays and lack of tests. And that's largely been opened up, although as I understand it, the FDA is still preventing home testing, which a number of startups have been trying to engage in. So I think that is certainly one area where if it's not fixed, it needs to be fixed. Another area that has had government control interfere with it is there's I think a pretty compelling argument, at least insofar as I've been able to judge it, that rapidly expanding the availability of masks, including to the general public, as one element of social distancing, it would be a very powerful tool, let alone the ability to protect, frontline workers or anybody who's highly exposed to the virus. But it's more, it is successful as inhibiting the spread from somebody who's already infected versus just protecting you from if you haven't been infected. But nevertheless, there's been a lot of government restrictions on the production of masks, and therefore there have been shortfalls in masks. And so, for instance, I recently read a tweet from somebody who said that I've been working on a N95 mask production project. N95 mask is just a kind of medical mask with a team for about a week now. We just got off the phone with the National Institute for Occupational Safety and Health. They told us that the approval for a new mass production facility in the U.S. will take at a minimum 45 days, but more likely 90. And he ended by saying a lot of people are going to die. Now, there was new legislation, I think, that came after this that seems to basically say that there will not be lawsuits against anybody who's going to move ahead with making these masks. I don't know the details, but certainly that's an area where if those haven't been removed, they need to be. One one general thing, I had an idea very early on that one of the most valuable things the government could do would just be have a website or a hotline where people could report what burdensome regulations were preventing them from responding. And it turns out that now the Booth School of Business at the University of Chicago is doing exactly that. So if you are involved in trying to deal with this virus in one way or another, and you're finding that there are government interventions, I think that is a good place to start about just letting the world know. Sure, if you just Google Booth School, University of Chicago, COVID regulatory pauses, that will come up. But I think that's a very high leverage area where we can expand freedom and therefore reduce the threats.
Yeah, and there are lots of other examples, and I'm certainly eager for any listeners to share any examples you have, because I'll definitely put them in the plan. In terms of what else the government can do, so I think that particularly the government has a role, has a big role in the scale of this problem in terms of negative things for a whole bunch of reasons. I think that it's legitimate and an emergency for the government to supplement the situation, as in encourage the production, but the context has to be it's allowing human ingenuity to come up with all sorts of solutions, and then it's providing some of the backing to do that more. And it may be helping businesses, paying them to repurpose production facilities for vital medical supplies. Certainly the whole way workers are being treated, I think that's a whole other subject, which is a really kind of just really unethical in many cases. So we really need to stop that, and we really need to help them out. So anything with supplies there, I think, is crucial. But it only works for the government to invest in it if people are free to create value. And that's the main thing that's being inhibited. And that's where the totally ingenious solutions are going to come from, where somebody comes up with a treatment and it just not even the experts expected it, but it can just dramatically reduce the symptoms of this thing. Like, we don't know how that's possible, if it's possible in what time frame, but the only way we're going to know is if people are free to think and to act. And then as consumers, as individuals, as citizens, we're free to judge. And then we should learn a lot of lessons from this about the future, that, oh my gosh, what if we were free all the time? Then yes, we would make mistakes, just like we make mistakes when compelled by government, just like government makes mistakes, but we would come up with all these amazing innovations that wouldn't otherwise exist. One more note about step 4, liberate American ingenuity to massively increase treatment ability. Final aspect of this that I alluded to earlier in the context of information is we want radically increased transparency about hospital capacity. Right now, we just see all these graphs that say, oh, well, in general, the hospital capacity will be overloaded if this many people get the virus with this progression. But what you really want to know is, okay, what's the trajectory in your area? Is your hospital overloaded? What's the status of that? Because that can really help guide your behavior. It can also maybe, you might even be willing to relocate for a while to some other area. I mean, we really want to avoid these situations where hospitals are overloaded. And so one aspect of that, not the only aspect, but is just transparency, so different people, both consumers of healthcare and also producers of healthcare, can make intelligent decisions. All right, step 5, help the vulnerable minority protect themselves. So the broader theme of this is don't stop living, live smarter. So key to that is to be smart. We need the information. That's why testing is the first thing government should be focused on. And then we need treatment, which is why liberating production of treatment is kind of the second thing. But then in terms of just as individual citizens, the focus needs to be on being really smart. And part of being smart is for people to take responsibility for protecting themselves based on their own risk profile, but also when they're trying to help others, focus on helping the most vulnerable protect themselves. This has been it's been mentioned, but it hasn't been mentioned enough, and particularly not in the different kinds of model projections. Like, COVID-19 is not an equal opportunity danger. It's overwhelmingly a danger to the vulnerable, especially the elderly. Now, you hear reports that, oh, it's a danger to everybody, and that's true to some extent. I have reason to think that when they're talking about younger people, it's mostly very compromised younger people. But I mean, certainly it's overwhelmingly greater for the more vulnerable parts of the population. And so anything that involves isolate everyone equally is immoral, and it is insane. If you're focused on flattening the curve, the best thing you can possibly do is help older people protect themselves, because as I've mentioned, they are not only the most likely to die, but they are going to be the ones to use by far the most medical resources and overload the hospital. So if you want to buy time, it's helping the vulnerable protect themselves. And if the government is going to do anything, that's what it should be focused on, doing things like helping deliver supplies. When I go to the grocery store, there's still older people there all over the place. Now, if this is their dream in life and that's their bucket list to go to Gelson's in Laguna Beach, then you know what? I'm not going to stop them. But if there's anything we can do to really help them protect themselves, what's often called cocoon themselves, that's incredibly beneficial. And it's really a travesty that the overwhelming focus hasn't been on that. And instead it's been on these mindless, these just totally uniform and indefinite, by the way, universal lockdowns on everybody that are not clearly explained and that nobody is even following now, or many people aren't following now. And they're certainly not empowering the elderly. Now, I think that there's no case, I do not think you should be able to lock down the elderly or the vulnerable by force for some indefinite amount of time. If there's some very specific emergency that you can prove by doing this for a week or two, or if it's like a real quarantine situation, okay. But like in general, people's lives belong to them. People want to live. And I do not think it's right to take an 80-year-old who's, their dream might be, I want to see my grandchild. I don't know how long I'm going to be around. I think it's just completely wrong to say, oh no, but you got to be inside for 18 months. Now, if they need to move to the bottom of the queue in healthcare and they're willing to do that, we should find a way to let them do that. But I really object in this whole discussion to the just total devaluing of living and people being able to live their lives as they choose. And that applies to younger people and that applies to older people. Then step 6 is go back to work and to school with distancing best practices. So lower risk Americans do not need to stop their lives to dramatically slow the spread of COVID-19. We've already seen that with even kind of crudely given guidelines without that much explanation, people have been willing to voluntarily do a lot. And there's you think about just the things like washing your hands more, avoiding touching your face, keeping more distance. All of these things are huge with regard to transmission. We don't have exact numbers, but just physically, if we understand how the virus works, how it travels, how the more the volume of exposure matters, all these things mean that we can do low cost, effective social distancing measures and get a huge amount of value in terms of slowing down the transmission of the virus without disrupting our lives. And so this is the thing, is to live smarter. And part of the guidance we need from experts is what are the highest leverage things we can do? What are smart ways to do things? And try to figure out smart ways to do everything. Might be even, a mass event. Maybe you keep people a little farther apart. You don't fill the stadiums as much, but we should be trying to figure out ways to do everything, like restaurants, spacing the tables out more. It's totally different to have, make the restaurant modify how they operate versus saying, no, you indefinitely, you cannot operate under any conditions. So I'm very interested from anyone, if you have good lists of, hey, what are good best practices? There's a good an interview I thought was good, at least methodologically, with Richard Epstein, not Epstein, interestingly, on the Cato podcast. It was just the one of him. He's in a debate on another one that I haven't listened to, but I thought he did a really good job. I don't know if his analysis of COVID is right, but in terms of identifying the methodological flaws of a lot of the catastrophe predictions, and then also he gave a lot of interesting, good prescriptions. So these kinds of best practices, distancing best practices, hygiene best practices, we can do so much with these and yet not disrupt our lives. So this can be a totally potent combination. If we start out with, okay, we're going to just get amazing at testing, that's number one. And then we're going to liberate our ability to treat and then just bring all the human ingenuity there. And that's number two. And then 3, we're going to really help the elderly and otherwise vulnerable protect themselves. That's going to be our focus because that's the most efficient way to flatten the curve and to save lives. And then at the same time, we are going to, we're going to go back to work, we're going to get busy living, but we're going to be smarter. That is an American solution. I think if we do this, we can avoid just the complete literal depression that we're headed toward and we can even be a safer and healthier and more benevolent country going forward. I mean, there's this idea of we're in this together, and I think we can be in this together if we're in this together in a way that allows us to truly live our lives in as much harmony with one another as possible. If certain people get to stop the lives of the vast majority of people, that's going to lead to huge resentment. And even if people feel like they're in this together now, they're not feeling like it when their restaurant is closed, their employer is closed, and then they're just getting, a couple checks from the government. And then how's the government going to pay those checks? Is it going to be inflation? There's no happy we're in this together if we cannot live our lives and be productive. So don't stop living, live smarter. I want to go into some of the other topics, but I want to ask if you guys have any quick thoughts, and then also just tell people, I really think this is the right general platform, the right general plan for moving forward. And I'm really interested in people who think they have something to contribute, either general expertise, or maybe you've just studied this a lot and you have good examples. Please share information with me, because this is not the kind of thing like a book on energy where I and my team have all the abilities needed. But I do think that this human flourishing, pro-living based framework, and also this emphasis on knowledge through testing and transparency, and also on intelligence through freedom to produce, as well as the freedom to judge and deal with threats. That's a perspective we bring that very few people are bringing, but I believe that is the American and the moral perspective. So any comments from you guys?
So one of the things that I was thinking about, and you touched briefly on it, I think in point 4, lessons learned, thinking strategically, which is one of the features of the human mind. A lot of the things that we did wrong apparently have a lot of lead time. So, producing enough emergency supplies and, rapidly changing the number of hospital beds and this kind of thing. And usually in our systems, these things are optimized to minimize the cost, which makes some sense if you don't have an emergency. But if you can't quickly change this, this is a problem in a crisis like this. So we should really be thinking about, and maybe this warrants a 7th point in your list, about what the system should be to take this into account, this experience that we are now having and that we can learn from. And something like, what are the problems with a funding model that we can quickly shift resources? What are the problems on the labor market regulations so that we cannot make available quickly the labor force that we need to take care of the vulnerable elderly or something like that.
Yeah, I think that's true. I may fold the first 2 points together. I don't like having more than 6 points in an outline, or in a plan. But yeah, I think there should be one. There should be something like that.